biggest mistake that insurance agents make when they're explaining Medicare supplements isn't what they say, but what they leave out. And the biggest thing that insurance agents leave out when they talk about Medicare supplements is rate increases. And a lot of insurance agents, what they do is they talk about benefits and how great Medicare supplements are, and they truly are, but there's one really dark cloud that hangs over Medicare supplements, and that is rate increases and whether or not you can afford the Medicare supplement in the future. Hi, my name is Eugene Marchenko. I'm a licensed insurance agent. I've been doing insurance now for almost 20 years, where we specialize in helping people with their health insurance, life insurance, and Medicare. This video, what I want to talk about is Medicare supplements. I want to give a general overview about how Medicare supplements work, and then I want to talk about the elephant in the room, which is how expensive they get. So, Medicare supplements. What's a Medicare supplement? A Medicare supplement is a program for seniors who have original Medicare A and B. The supplement helps fill in the gaps of where Medicare doesn't pay for certain things. So for example, Medicare covers about 80% of approved medical expenses. Depending on the Medicare supplement that you choose, they'll pay the other 20%. Now there's 10 different Medicare supplements to choose from. The government standardizes these supplements, meaning that the government chooses the benefits. These insurance companies don't have a say in the benefits. They can only choose which Medicare supplements they decide to sell. Plan G and Plan N are the two most popular Medicare supplements, and what they do is they pay the other 20% that Medicare doesn't cover. So if you go to the doctor, if you go to the hospital, after you've met your Medicare deductible, Plan G and Plan N will pay the other 20% after Medicare's paid their 80%, essentially giving you 100% coverage. Now, Plan N has a little bit more caveats than the Plan G, where there's certain copays that you'll have to pay at the doctor's office and the emergency room, but generally speaking, they're pretty much about the same. The biggest difference, though, is the rates. Plan G, on average, has about a 20-30% higher rate than Plan N. In South Carolina, for example, my home state, a Plan G runs around $120 a month for somebody turning 65, whereas a Plan N could run between $80 and $90 a month. But a lot of people ask, well, what's the difference between a Medicare supplement and Medicare Advantage? Well, benefits is a very, very big one. And I already did a video and when I talked about the benefits of original Medicare versus with a supplement versus a Medicare Advantage plan. So I'm not going to go into that today. But what we did talk about is Medicare supplements generally cover more, meaning that there's less out of pocket, right? So unlike Medicare Advantage, where they cover like dental, vision, hearing, and things like that, Medicare supplements don't have those extra features. You have to pay for those features separately. But where a Medicare Advantage plan, your out-of-pocket could be, $500 for cataract surgery or $1,000 for a couple days inpatient in a hospital. With a Medicare supplement, it's pretty much 100% coverage. So you're not going to pay anything other than your premium. Let's talk about this premium, because this is something that a lot of agents don't cover with their clients. And this is very, very important because you need to make sure that you set the expectation. If a client could afford Medicare supplement today, doesn't necessarily mean that they can afford the Medicare supplement in the future. And that's something that you have to be careful, because you're going to have a client who's going to spend all this money on a Medicare supplement, never use it, then get all these rate increases. It turns out that 5 years down the line, they no longer can afford the Medicare supplement, and then they may have to go to a Medicare Advantage plan. So what I do when I speak to clients is I do a very good job of explaining Medicare Advantage versus Medicare and with a supplement, but then I really take the time to explain rate increases, because I want to make sure that my client not only can afford the Medicare supplement today, but can afford the Medicare supplement in the future. And the way Medicare supplements work in most states, once you are outside of your open enrollment period, meaning that you're either new to Medicare because you turned 65, or you're new to Medicare because you're retiring from an employer and you're starting your Part B for the first time, with the Medicare supplement, once you're outside of that open enrollment period, if you want to get a Medicare supplement, or change your Medicare supplement to a lower rate, you're going to have to medically qualify. And if you're healthy, us as a brokerage, every couple of years, will change you from one company to another, because again, Medicare supplement benefits are pretty much the same. So we can move you from one company to the next. But what that does is it doesn't stop rate increases, it just starts the clock over again. So if you start at 65 and at 68, your policy went from $100 a month to $140 a month. Now we find you a company that will charge you $110 at 68. What you did is you just restarted the clock, but you didn't fix the problem of rate increases. And that's something that could never be fixed, because every Medicare supplement out there will have a rate increase. The only programs that don't have rate increases in most cases are Medicare Advantage plans. A lot of those are zero premium, and in some cases, $20, $30 a month, but they don't really go up in price the same way Medicare supplements do. Also, this is not a video talking about if Medicare Advantage is better than Medicare Supplement. They both have their place, and no, not one is better than another. But if you do go with the Medicare Supplement, it is very important that you know that there's going to be future rate increases that will happen, 5 to 7%, sometimes 12 to 15%, depending on the company. But those rate increases will happen, and it's important that you discuss those rate increases with your agent. Your agent should have access to averages over the last couple of years to kind of predict what the rate increase will be in the future. Also, stay away from the best possible premium on that Medicare supplement when you first buy it, because there's a lot of companies that may have higher rate increases, and they may be trying to buy out the market with the lower rate, get you locked in, and then start charging you 12 to 15%, where you could have paid a little bit more for a company that has less rate increases, and maybe you can keep that company for longer with a better rate. Now, if you decide you want to get a cheaper rate, let's say you're 68, you're 70 years old, be prepared. You will have to go through medical underwriting. And depending on your health, some people just may not be able to qualify, and they'll be stuck with that company pretty much forever, unless they go with the Medicare Advantage plan, right? You want to make sure that you're picking a company that doesn't increase as often, so not only have a lower percentage of rate increase, but instead of maybe having a couple of them a year, maybe only have one a year, right? Which should be the average. So you just want to make sure you do your homework. You want to talk to your agent not only about benefits, you also want to talk about price, and you want to talk about future rate increases. Don't get blindsided. I know a lot of people, a lot of agents, they do leave that information out. And that's something that's very, very important that you bring up with your agent, so that way you pick the best reputable company. If you like content like this, subscribe to the YouTube channel, follow me on Facebook, on Instagram, and I'm going to be releasing more and more content like this, where we talk about the benefits of different plans, different programs, and more specifically, we're going to talk about things that a lot of agents try not to talk about, right? So we're going to leave everything on the table, and that way you can make a good decision when it comes to your Medicare. If you have any questions, please reach out. My contact information will be down below. I'm happy to help you as the client, you as the agent, whether you're trying to help your clients or you're the client yourself trying to better educate yourself on the different programs available. My job is to help anybody who's watching these videos, whoever finds this information useful.